I just noticed that my shirt's glowing in the dark. Whatever. Hey, good afternoon. Sorry, better late than never. We're going to talk today a little bit about fasting. People forever, as far back as recorded time, has said that fasting is something that is good for you. Now, biblically, if we look inside of our Bibles, we see that fasting was something primarily for spiritual connectivity, to be able to get yourself off of the focus of the things of this world into more of your relationship with God. True. Primary. Today we're going to talk about, could laying off food be good for a breast cancer patient? Now, you may know somebody that is fighting breast cancer. The newest therapy are these immune modulators that, typically boost your own immune system to fight breast cancer. And there's a lot of new drugs like Ibrance and a lot of other ones that are hormonal therapies. But what would you even consider telling a breast cancer patient, with the fear factor of losing too much weight? You know what it's like when people are fighting cancer and they start losing weight. Could you dare go to them and say, you know what, I think it might be better for you to start fasting? They're going to look at you like, no, wait, I need to keep my weight on. I need to eat because the therapies that the doctors are giving me are making me nauseated or whatever. Do you think fasting is a good thing while you're fighting breast cancer? I find this article intriguing, and I'm doing this as a YouTube video because I think this is one that needs to be shared. This is something that, you shouldn't do on your own. So if you're listening right now and you're in the battle for your life and you're battling breast cancer, don't arbitrarily say, I'm just going to stop eating. No, that's not it. We're talking about fasting mimicking diets. And that's a term you may not have heard before. So I'm going to read this from the University of Southern California. A Southern California-led team of scientists had found that a fasting mimicking diet combined with hormone therapy, that's your standard of care, has the potential to help treat breast cancer according to a newly published animal study and clinical trial in humans. In studies on mice and in 2 small breast cancer clinical trials, researchers at USC and the Cancer Institute in Milan, in collaboration with the University of Genova, found that the fasting mimicking diet reduces blood insulin. Obviously, keep in mind, insulin is what our body makes to take care of glucose. If insulin starts to go high, insulin resistance starts to kick in. It raises the aura of cancer, not just for breast cancer, for any kind of cancer. So we want to keep our insulin levels as low as possible. So we said that the fasting mimicking diet reduced blood insulin. It reduced IGF-1, that's insulin-like growth factor. So again, we know that cancer is a consummate sugar consumer. It also reduced leptin. So guess what happens when we do this? Believe it or not, you fast, you break that constant hunger issue that we get. In mice, these effects appear to increase the power of cancer hormone drugs like tamoxifen or fulvestrant and delay any resistance to them. So, I'm not a fan of tamoxifen, please. There's newer generations of those hormone blockers. Tamoxifen comes with way, way, way too much baggage. And the newer drugs, much more effective. And the problem is, right now, somebody's been on tamoxifen, the doctor says you're going to be on this once a day for 5 years, max, maybe sooner. Because any day beyond 5 years, you become at a higher risk of another cancer, ovarian cancer, uterine cancer. The results from 36 women treated with that hormone therapy and put on a fasting mimicking diet are promising. The research was published in a journal called Nature. Our new study suggests that a fasting mimicking diet together with endocrine therapy for breast cancer, that's again hormonal blockade, has the potential to not only shrink tumors, but reverse resistant tumors, said Valter Longo, the study's co-senior author and director of longevity at USC. He says, we have data that for the first time suggests that fasting mimicking diet works by changing at least 3 different factors: insulin-like growth factor, leptin, and insulin. Breaks 3 big cofactors that are responsible for the propagation of breast cancer. The researchers said the 2 clinical trials are feasibility studies that showed promising results, but they're in no way conclusive. They believe the results support further clinical studies of fasting mimicking diet used in combination with endocrine therapy and hormone receptor positive breast cancer. There's the asterisk. If you're listening to this right now and you're battling breast cancer, this applies to hormone receptor positive, estrogen receptor, progesterone receptor positive. The scientists also contributed to a recent clinical study of 129 breast cancer patients conducted with the University of Leiden. The results published last month in the Journal of Nature Communications appeared to show increased efficacy of chemotherapy in patients receiving a combination of chemo and fasting mimicking diet. So when somebody's ready to get started, if they do this fasting mimic, what am I meaning by that? We'll get into that. In the 2 small clinical trials, one which was directed by the study co-corresponding author Alessio Nencioni, patients with hormone receptor positive breast cancer receiving estrogen therapy along with cycles of a fasting mimicking diet seemed to experience metabolic changes similar to those that were done in the animal study. These changes included a reduction in insulin, leptin, and insulin growth factor, those 3 biggies that contribute to the propagation of cancer. The last 2, leptin and IGF-1, remained low for extended periods. These long-lasting effects were associated with long-term anti-cancer activity. So further study is needed. Some patients followed monthly cycles of the fasting mimicking diet for almost 2 years without any problems, suggesting that it is well-tolerated intervention, Dr. Nencioni said. We hope this means that this nutritional program that mimics fasting could one day represent a weapon to better fight cancer in patients receiving hormone therapy without any serious side effects. The results in animals are very promising, and the early clinical results show potential as well. But now we need to work in a 300 to 400 patient trial. The data also suggests that in mice, the fasting mimicking diet appears to prevent tamoxifen-induced endometrial hyperplasia. That's what I was saying. Uterine cancer, or thickening of the uterine lining, which is a potential for cancer. A condition which when the endometrium, or the lining of the uterus, becomes abnormally thick. The study authors believe this potential use of the fasting diet could be explored further, given the prevalence of this side effect of tamoxifen. And there's no options that they have for preventing it. Approximately 80% of all breast cancers express estrogen and/or progesterone receptors. The most common form of hormone therapy for these breast cancers work by blocking the hormones from attaching to receptors on cancer cells or decreasing the body's hormone production. Endocrine therapy is frequently effective in these hormone receptor positive tumors, but the long-term benefits are often hindered by treatment resistance. The longer we go, the less effective the treatment is. Several clinical trials, including the one on USC on breast cancer, and also done on men on our side on the prostate cancer, are now investigating the effects of a fasting mimicking diet in combination with different cancer fighting drugs. I like to call it the non-toxic wild card for cancer treatment, Dr. Longo said. I love that, the non-toxic wild card. These clinical studies we have just published, together with many animal studies published in the last 12 years, suggest that cycles of fasting mimicking diet has the potential to make standard therapy more effective against different cancers each time by changing a different factor or a nutrient important for cancer cell survival. University of Southern California, originally written by Janice Miller. Again, fasting mimicking diet and hormone therapy induced breast cancer regression. Now, attached to this are some other studies. A combination of fasting plus vitamin C, effective for hard to treat cancers. Story number 2, fasting mimicking diet holds promise for treating people with inflammatory bowel disease. Story number 3, strategies to mimic fasting during chemotherapy enhanced anti-cancer T cell activity. Lastly, fasting-like diet reduces multiple sclerosis symptoms. We're going to file this under breast cancer because that's where it goes. So what do I mean by fasting mimicking? Well, you can't and you don't want to completely go without food. So when we understand this, what do I mean? If you've been a regular follower of me or anything that goes on here at the Nutrition Shop, you know that our church, one church here in Peachtree City, started the New Year's out by having all church members do a 21-day mimicking fast. What did we do? We ate one meal a day. No breakfast, no lunch, balanced dinner. Now, during the course of that, I lost like 13 pounds because I had it to lose. If a breast cancer patient has it to lose, it's a good idea to get rid of that excess fat. But it's also not that difficult to do. I mean, the first couple days were a little rough, but after that, it just sort of flowed. But again, I strongly recommend, I'm putting an asterisk on this YouTube video. Do not try to do this on your own. Call and set up a time. We can quickly go through this and make sure it's safe enough for you to do. 678-228-8900, 678-228-8900. Take the time to concentrate. Share, please. Share this YouTube video with anybody you know that's fighting breast cancer right now. Hormone positive breast cancer, please. The website is the Nutrition Shop, SHOPPE.net. Wealth of information there. Right now under the resource tab, a new big article that Brian wrote on COVID-19. You need to go there and read it. Wonderful information. Hopefully this helps. All the news that's fit to print. Anything else you need, please give us a call. 678-228-8900. God bless you, folks, and I'll see you back here the next time. Take care.